Social media platforms for a lot of our patients are one of the main ways that they can talk to other people who have things in common with them, who are going through some of the same issues that they are, and I think that's really wonderful. However, I do see a lot of people who get stuck in negative talk about things. I'm often faced with people who come to me as a new patient and they're really discouraged because all they read about on these social media platforms is negative stuff and people who don't get better. And I always say to them, okay, I know that's not true because I have my patient population and most people get better, but they don't go online. Once they're better, they move on with their lives. And unfortunately, a lot of people who are still sick and still at home and still, don't have a lot of outlet. So I would just be careful if you are one of those people that's new to treatment or you're trying to get through treatment and you're discouraged because everybody's saying that they're not better, because it's not true. It's just that the people who are talking about things are the ones who are not better yet. And I might add that a lot of those people seem to be the ones who don't do the treatment, who have, either because they have a lot of brain fog and they can't get their mind around what they need to do. For whatever reason, they don't do the treatment, because people who do the treatment get better. So recently I was reading a book about stepfamilies. And it was written by a psychologist, and she pointed out that there's a lot of really bad information online about how best ways to deal with stepfamily situations. And she had a word called woozles, I think it was, which basically is a word that means websites that have very bad information on them. So sometimes, with psychology, you see a lot of things written by people who aren't qualified to be writing things online and giving people advice. The same thing happens in medicine. And, there's actually a little bit more complex issue with medicine, because there's the conventional view, WebMD, Mayo Clinic, etc., who have a pretty simplistic type of approach to a lot of medical conditions because they're trying to dumb it down for lay people, I think. And they also, are very limited in their scope because they only talk about conventional medicine, and alternative medicine is a whole other arena. And then there's also, people who don't have medical backgrounds, who have opinions, and who write a lot of articles and blogs about, and giving advice to people about health stuff. And sometimes people come to me with very big chunks of information that is wrong. So we spend a lot of time talking about what is actually true. Sometimes people come to me with ideas about what they want to do for treatment because they read it online. I would just caution anyone who has gleaned information online that you always have to take things with a grain of salt. And people come to me and they know this. Well, I'm not going to Google that because that symptom or that set of symptoms, because then I'm just going to think I have cancer. And the reason is because there's a lot of information out there, whether it's wrong or right. Being able to put it together into a coherent framework in your individual case is difficult. The reason that I went to medical school was to learn how to do that. I wouldn't do my own financial advising. The reason that people come to me is because I have this expertise. Unfortunately, with biotoxin illness, which is one of the main things I treat, people have a lot of brain fog and a lot of circular thinking, and it's difficult for them to get their mind around concepts and things like that. And, we try and do a lot of talking and giving handouts and things like that, but sometimes people can get stuck in this, well, I read this online, or I did this, or that type of thing, and it can be challenging to deal with. So if you are one of those people, I would say find a good practitioner, be willing to trust them too. So one example is a patient of mine who had an H. pylori test come back positive. This is a bacterial infection of the gut, and it does need to be treated. In my clinic, I mostly treat H. pylori unless there's a lot of virulence factor associated with it on the test result. I mostly treat with herbs and licorice and things like that that are very, very effective, rather than just triple antibiotic therapy. This patient had a positive H. pylori test. I gave her a treatment plan. She went home and read online about, she wanted to add hydrochloric acid to support digestion. But unfortunately for H. pylori treatment, that's contraindicated. You're actually trying to control the pH and raise the pH because the bacteria like it acidic. And so this is a situation where, I had to explain why you would not want to do that and try and get her to just stick with the plan rather than trying to go and find more stuff that she could do. So one of the things that I think is a particular strong point of integrative medicine physicians is that all of us do fairly extensive 30 to 60 minute follow-up appointments. And part of the reason for that is because we want to make sure that people have all their questions answered and they understand exactly what we're doing. And so we can talk about, I read this, or what do you think about that? The other thing is that it gives me adequate time to clarify misinformation and explain what the process is and what the treatment is for and why we do this or we don't do that.